Hi there. Good afternoon, everyone. Hello. I'm Dr. Virendra Kumar. I'm an intervention cardiologist. नमस्कार दोस्तों, मेरा नाम वीरेंद्र कुमार है. मैं एक हृदय रोग विशेषज्ञ हूँ. Today I will be discussing on this Facebook Live about the impact of wearable technology, the impact of the digital wearable technology which monitors our vitals, you get the heart rate, blood pressure, and those parameters, and the impact of these technology on the healthcare and health of a population in general, and the doctors and the patient in particular. So we will wait for some time to people to join, and before starting, let some more people to join. So this is era of changing healthcare and healthcare technology. We are witnessing different healthcare scenarios in the country and worldwide also, where more and more people are witnessing sudden cardiac death, cardiac arrest, unplanned, unprecedented cardiac events. We see every day we are actually witnessing that somebody is playing cricket and he falls down and loses his life. We are witnessing somebody is performing on the platform and on the stage, and he dies while he's act. We are witnessing the cardiac events, sudden cardiac events in young population, and also we are witnessing increase in incidence of the cardiac illness and other illnesses in general population. Those who are elderly, those who are middle aged, those who are young, everybody, every set of population, every section of the population is witnessing increase in incidence of these cardiac and non-cardiac diseases. So besides the traditional approach of the treatment and therapy and preventive approach, the changing technology, healthcare technology is actually helping us and changing many things. There are good outcomes for the of the users of these technology, and there are some precautions and some adverse effects also. So today my whole Facebook Live will be on this wearable devices and technologies which which is there in the market, and not only in the Indian market but globally. It's there in the form of the smart watches, in the form of the smart wristbands, in the form of health bands, and all those. There are some devices which are used by a professional like us for monitoring of the heart rhythm, that is washable, and the external loop recorders are there, external Holter monitoring are there. They are smart devices which is put on the chest of the patient, and the patient is monitored digitally in the real time for their any sort of arrhythmia. So today's live is all about what these technology are, or how a general people and even health professional use that technology for a maximum, and how to be aware of the false alarm it gives, and how to be informed about these technologies so that we can use. So coming to the technology, there are technology or the smart devices which can be used by the general population. These are in the forms of smart devices, that in the form of wristwatches, smart wristwatches, in the form of health bands. Some have display on their screen. There is a display screen is there with the wristband, and some are attached to the or integrated to the app in the mobile. So many of the app in the mobile, you can use your thumb or fingertip to record the data. So what is the any device in any form, whether it is a wristband or a smartwatch, it records the vitals, the basic parameter, that is your heart rate, your blood pressure, your body temperature, and the metabolic activity, the basal metabolic activity, and the activity, how these data are captured and stored in the device or the app it is connected to. So my concern or my thought was to discuss with you all people how we can use this technology for the betterment. Recently, many of us had witnessed a news where Dhoni was wearing some, Mahendra Singh Dhoni was wearing some wristband, and that was in very news. That is one of the wristband manufactured in the USA in the collaboration with the company people and the doctors. And what these wrist technology do, these acquire data from you, and these data can be interpreted scientifically, and also these data can be misinterpreted unscientifically. When you are interpreting this data scientifically, this will help you beforehand or help in diagnosing, help as a preventive approach, help in monitoring. And if you are not interpreting this data properly, that can lead to false alarm and unnecessary anxiety to many of the. We are seeing daily people who are using smartwatches coming to the clinic with a increased heart rate or heart rate variability or blood pressure variability. So whole life is about how to use this, how to be informed about this technology. So grossly, these wristbands or the smart devices or wearable devices are used for monitoring your vitals. So how these are helping? If you are a young man, you do not have any disease, and you want to be healthy, everybody wants to be healthy, how this will help? If you are wearing some health band, or these data will alarm you about any abnormal increase in heart rate. If you find there is alarm about abnormal increase in heart rate, then you can consult your doctor about the increase in heart rate, whether it is a form of a disease, that is arrhythmia, or it's a normal increase in heart rate with activity. And the physician or the cardiologist will definitely sort the problem out. So before any untoward events occurs with increased or decreased heart rate in the form of either giddiness, syncope, or any form of shortness of breath or anything, you actually diagnosing the disease before it is actually harming you. So in this case, it's a sort of diagnosing the disease in a pre-pathogenesis phase, that is before the events. This will definitely help. India is witnessing lots and lots of cardiac events in young. If somebody is wearing these wristbands, they have an idea of heart rate, they have an idea of the increasing heart blood pressure. And also, if somebody is young, healthy people, a person, he wants to monitor his recovery from anything, or he wants to be alert about any decrease in his health parameter, whether it is endurance. So these devices will also guide you about the length of sleep actually you are missing, whether you are sleeping well or not, whether your basal metabolic rate is good, whether your physical activity is up to mark or not. So we can use these data, these devices for monitoring our health. On the contrary, if you're very too much into these devices, and even a slight change in blood pressure or heart rate can can alarm your and you can become anxious. So these are the two sides of these use of these devices. Coming to the how this can help health professional, many of the doctors can use these for monitoring. Suppose somebody is suffering from some myocardial infarction, he had heart attack, underwent angioplasty. Now you want to monitor his vitals. It's not possible for everybody to come to clinic every day. If you advise a wearable device for him, and you can follow those data, and you can also teach the patient to monitor his data, and if he comes with a good amount of data with how his heart is actually doing at workplace or home, that will definitely help in following the patient. So these devices helps in diagnosing the cases. Also, these devices helps in prognosticating and following the patient in their healthcare journey. And these devices also will help in monitoring large population. Now, India is facing a situation where there are lots and lots of hypertensive patients are there in general population. They are in their villages and they are not diagnosed. Actually, we are not able to diagnose all those having hypertension and arrhythmias. Many people feel palpitation, increased heart rate, but when he goes to the clinic, the heart rate settles down, and every time ECG comes normal, and the whole workup is done, but we are not able to find whether there is anything abnormal there. Many a time we do a 24-hour Holter monitoring for the any sort of arrhythmia the patient is having. Many patient comes with a giddiness, with a transient loss of consciousness, like syncope or a seizure-like activity. And when you do ECG in a clinic, you find the ECG is normal, but patient is actually having many young female comes with a palpitation and a vague symptoms, and physician or many a time label them as a anxiety neurosis or any functional disease, not having any organic disease. But most of them, not most, but many of them have actually supraventricular tachycardia or atrial fibrillation or not atrial fibrillation in many cases, but supraventricular tachycardia in many of the cases. So just advising her to wear a smartwatch will definitely help to diagnose whether his tachycardia is in the range of 100 to 120, or it's a tachycardia of 180, 170. That will definitely differentiate the many devices can record ECG. Many are the medical devices which are wearable technology. Using wearable technology can actually record ECG in real time. Suppose somebody is having palpitation or giddiness or any diaphoresis, and his recurrent history of recurrent transient loss of consciousness there, and you are not able to diagnose as a doctor or as a general population, you are not finding any solution. You are going to one place to another place, one doctor to another doctor, lots and lots of investigation already been done, but you don't find the solution actually because diagnosis is not settled. Whether these symptoms are due to increase or decrease heart rate or something else. In those cases, if you advise him to wear a smartwatch or a smart health band or some disposable patches are there which actually records the heart rate in real time. So these are the beneficial effect. The other drawback of using these devices are for general population, those who are using actually smartwatches and wristwatches. They find that every time they see an alarm in their watch, and they get anxious about whether he's going to suffer some big cardiac or non-cardiac illness, or so these are the mental issue, the anxiety component of using these devices there. for those sportsmen or those who are actually going to gym or workout, these devices are actually very useful to monitor their vitals, because we are witnessing many of the cardiac event in the gym and the exercise arena and the playground. These devices are also many of the devices are programmed to guide you about your how much actually exertional load you can give to your body. So actually these devices are good. These are futuristic devices and futuristic technology, which will definitely help in patient monitoring, in diagnosing the event before it becomes catastrophic, and also those who are under treatment for some days. Suppose for hypertensive patient, these devices will definitely help in guiding any episode of accelerated hypertension, that is sudden rise of blood pressure is there. These devices will definitely alarm the person, and he will get advice. Many of the stroke can be prevented just by diagnosing the first episode of accelerated hypertension. You can definitely prevent many atrial fibrillation, many tachycardia, bradycardias can be diagnosed easily if you're actually using these smart devices smartly. So caution for the general population is that use device, but use it with caution. Do not get alarmed by everything, and do not get panic for every alarm it gives to. And for those who are in active sports, in active gymming or active sports, or very active in their life, young people, those who have a family history of sudden cardiac death or any cardiac event, must wear these. That will definitely give many young lives are lost due to congenital diseases. Many congenital diseases are there which have propensity or tendency to increase your heart rate and through arrhythmias, and these rare diseases, genetic diseases, can be diagnosed, or many of the population many of the life can be saved by using these devices. Only issue is that whenever you are using any technology, you must be aware of the pros and cons, and you must be sensitive enough, to adopt those devices, because each time you see some alarm with some sort of information, some of feedback from your device, and you get panic or anxious, these will definitely not help the cause. Beautiful part is that we are the country with so many of diabetic and hypertensive population, and we know the hypertension, diabetes, dyslipidemia, these are the major causes of sudden cardiac death and cardiac event, cardiovascular event, and strokes, cerebrovascular event. So major killer of the country are those the cardiac heart attacks, stroke. These have a strong association with hypertension, dyslipidemia, and diabetes, and hypertension. Definitely you be able to diagnose in more and more young people who are using these devices. So this is actually these technologies are wearable technology are good for diagnosing many of the diseases, not all diseases. And best part is that they will alarm you before some major cardiac event, and if it is and if it gives to you a few minutes or few hours of the time before a major cardiac event or non-cardiac event, that will definitely help in saving many more of the lives. So with this, I would like to close this Facebook Live, and I definitely I think will this whole live will be helpful to many people, and they will be using more of this technology, and those who are using will not be scared of each and every input or alarm it gives. So with this, bye bye to everyone, and see you in the next live with a new topic.